Welcome back, everyone. Today is Bell Let's Talk Day, and in Canada, more than 50% of people who are struggling with their mental health aren't getting the help they need. For some, getting help includes finding the correct medication to assist with their mental health recovery.
And we want to take the time now to help further break down the stigma and discuss antidepressant medications, which are used to treat anxiety and depression. So back with what you should know about the options available to us all, Dr. Sheila Wijayasinghe is here. Dr. Sheila, welcome.
Welcome.
Always love having you here. When it comes to medication for mental health, what are some things that first things that you want people to know?
So the first thing I want people to know are medication and getting help for mental health conditions is a really courageous step. And it's important to know that medications are meant to help you feel more like yourself.
Yeah.
And so a hallmark feature of depression and anxiety is that we can have decreased energy and motivation to do the things that we love to do that help make us feel like ourselves. And medication is meant to bridge you back to those activities. And so the thing like connecting with people, going to exercise, sleeping better, those are all things that are meant to be helped through medication use, and they help you feel more like yourself. And I had this beautiful story this week, if I may share, and one of my patients said that it was okay for me to share. She gave me permission. And I've been caring for her for over a decade, and she struggled with anxiety disorder for many years. And she's done therapy and otherwise, and it's been helpful, but the pandemic was really hard for her. And so recently we started her on medication, and she was initially not very keen on doing that, but she started, and she came back in this week for a reassessment. And she said to me, she said, you know, I didn't realize that for the last several years, I've just been existing. I now feel like I'm living again. Yeah. And it was so profound, and I felt like it just fits so well with this conversation we're having, so I'm so glad that we're here to talk about this.
Yeah,
Wow.
thank you for sharing that.
Yeah.
And especially because there are a lot of people in this country who are having a very hard time accessing like a psychiatrist. And so for people like your patient who have decided that they would like to try medication, who can prescribe it and what's that process like?
This is so important to talk about because often we think that psychiatrists are the only ones that can prescribe, but any physician can prescribe medication in terms of antidepressant medication. So family doctors, pediatricians, nurse practitioners can as well. And so it's important to know that you can see your own family doctor to talk about your mental health. And actually, to be honest, it's probably one of the most common reasons people come to see us in the family doctor's office is around mental health. And so you can come see us, we'll do an assessment just like we do with any other diagnosis, physical and otherwise, to make sure that we're diagnosing the correct thing, treating it appropriately, understanding your history and what your goals are, and then choosing the right option that's right for you.
So let's talk about the fact that there are many types of medication for different disorders. Can you talk to us about some of the most common?
The most common medications that most people have heard about are the SSRIs and the SNRIs, so the selective serotonin reuptake inhibitors, so Prozac, Zoloft, those ones are very commonly used. So they're our first line. Also SNRIs, which are serotonin and norepinephrine reuptake inhibitors. And these medications increase serotonin, the first one, and the other one, the second one, increases serotonin and norepinephrine, which help to balance your mood and anxiety levels. So those are the most common ones that we use. But there's newer ones coming out all the time.
I'm sure a lot of patients will always ask when they're starting out, like, how long will this take until I feel better? Can you speak to that, and also sort of the trial and error process with finding that medication and the dosage and so on?
So important. Anytime you start a medication, it's important to know how long does it take to take effect, because it can be frustrating to wait for the effect to happen. And antidepressant medications do not work overnight. They can take up to 6 weeks to see an effect. And so often some of my patients will come back and they say, it didn't work in a couple of weeks, I'm done.
Yeah.
And then I wish that we had talked a little bit more about the time frame that it would actually get to see that effect. So it can take about 6 weeks for us to see an effect. If it's not, and all of our minds are different. So the mechanism of action of these medications is all similar, but how our mind responds and our brain responds to it may be different. So one medication that works for one person may not work for somebody else. One medication that worked for you earlier in life may not work for you later in life. It's important to know that you can come talk to us and we can find the right fit. And it is a trial and error. There's a newer technology that's out that sometimes we use in case of people who may not have a easy time finding the right fit, and it's a cheek swab. Only certain centers will do it, and it actually looks at your metabolism and susceptibility to side effects. And so that can be something in case that we can work with our psychiatry colleagues to have those tests done.
Well, that's fascinating. I'm wondering if there are other factors that could impact the efficacy, like sleep or lifestyle.
Absolutely. So medication is one part of our treatment plan that we use. Anytime I'm prescribing a medication, I always combine it with talk therapy, exercise, talking about sleep. sleep. We know that head-to-head trials between talk therapy like CBT, art therapy, and medication have found equal outcomes. Same thing for exercise and medication. So they're equally effective if they're done together too. And so it's important to know that there are other things that are just as important, external to medication, that are crucial to healing.
So if you do start meds, you've decided to make that choice, does that mean you're going to be on meds your whole life?
Great question. Similar to how long does it take to take effect, how long are you going to be on it? So we always do a bit of an exit strategy when we start a medication with my patients, especially antidepressants. And the key thing is that if you start to feel better, you might stop it prematurely, and that's a risk because we know that you can relapse early if we stop too early. So once you start to feel better on an antidepressant medication, the recommendation is to stay on it for 6 to 9 months.
Okay.
And then at that point, we can start to taper down. Some people need to be on medication for life, and that's okay. And some people need to be on medication on and off through their life. So it's something that you want to work with your doctor and our healthcare provider with. We don't want you to stop taking it immediately. Sometimes you get the 9 months, but let us taper it with you because you can have a discontinuation syndrome, meaning that you have withdrawal. We want to avoid that, and we can help you through.
What do you want people to keep in mind if they are thinking about starting a medication for the first time?
So I think it's so important to keep in mind seeking help, asking for help in terms of medication or whatever form of support that you're looking for is a sign of courage, and it's important to have these discussions. Despite talking about it, there's still incredible stigma around mental health, and I want to encourage everyone to find that space to ask for help, and medication may be one of those options that helps you. It's also important to know that antidepressant medication can interact with other medications, including natural medications like St. John's wort, and so just keep in mind if you're on those medications to be aware. And finally, we live in Canada, we have a publicly funded healthcare system, which is incredible, but not everybody has access to mental health supports, to therapy. Medication is expensive for many, and we need to work together collectively as a society to make sure that we understand that mental health is health, and we need to advocate to make sure that everybody has access.
Wow. Absolutely. Dr. Sheila, what an eye-opening conversation.
Yeah, thank you so much.
Thank you very, very much. We really appreciate that. Wow. We want to tell everybody watching, check out and keep an eye on our social media channels. Dr. Sheila will be sharing some really great resources to help you access the mental health care that you need.
Hey there, wasn't that great? Do you know where you can find some equally good content? Our YouTube page. It's filled with discussions, debates, and some laughs. Head there now, like and subscribe.